Welcome to my brief presentation about how could IoT assist healthcare system during COVID-19 or future pandemics. My name is Mohammad Nasajpur. I'm a graduate research assistant here at Kansas State University, and this is part of my research towards my thesis through College of Computing and Software Engineering. My advisors in this research were Dr. Puvia and Dr. Parisi. This research project seeks to define a roadmap of applicable solutions based on the Internet of Things technology for mitigating COVID-19 and future pandemics. We looked into addressing three baseline questions. First, what are the current IoT state-of-the-art applications to fight COVID-19? Second, how do IoT applications fit in the different phases of COVID-19? And lastly, what major tasks could IoT applications perform using different sensors and devices? Our project study began by research questions. We then determined the essential keywords. Next, we focused on the existing research gaps on applying IoT in healthcare during a pandemic. Then we collected the published and peer-reviewed papers that were mainly focused on our topic. Finally, we defined a roadmap based on IoT applications to combat this virus. Basically, to develop more accurate and real-time approaches, we divided COVID-19 pandemic into three main phases of early diagnosis during quarantine and after recovery. Within the first phase, IoT could assist with diagnosing symptomatic and asymptomatic patients faster. Quarantine phase is mainly focusing on the isolated patients and prevention of further spread of this deadly virus. Lastly, in after recovery phase, IoT enables authorities to better manage the pandemic regarding the assigned safety measurements such as social distancing and face coverings. It is also important to note that each phases of COVID-19 includes five main categories, which are wearables, drones, robots, IoT buttons, and smartphone applications. In the next slides, we briefly discuss a few examples from each phase. Within the first phase, smart glasses, smart helmet, and thermal drone could be applied to capture or screen the temperature of people in the crowd. This enables to find people with high temperature or fever, which is one of the main symptoms of COVID-19. Within the second phase, IoT wearable band could be applied to monitor whether the isolated case stays in the quarantine zone or not. Disinfectant drone could also assist with sanitizing the isolated areas, for example, hospitals. And the last one, medical drone, could deliver treatments to the isolated people. In the last phase, IoT wearable band could be applied in order to alert the user of any close physical activities with others. Surveillance drone could monitor the face coverings and similar to distance robot, it could monitor the practice of physical distancing. What proves our research as a good roadmap? Our paper was accepted in the Journal of Healthcare Informatics Research. Regarding its statistics, it got cited 27 times so far, and also it has been accessed for more than 17K since November 2020. Our second research is regarding the overall contribution of IoT in this pandemic, and we have divided it into five main tasks, including monitoring, diagnosing, tracing, disinfecting, and vaccinating. As you can see, each task could cover different elements, which helps mitigating this virus faster. The second paper is under review to be published as a book chapter within the Elsevier, and it is a complementary approach for enhancing the quality of the proposed roadmap. Note that the conducted paper and the book chapter are both being used towards developing a pure research. Thank you for watching our presentation. Please visit the links listed below to learn more about our researches.